Hi guys, my name's Tarnie. I just want to say a very big thank you to the Nurse Break for inviting me to come and speak about my experience being a enrolled nursing student. I am super excited to talk to you all things nursing, all things enrolled nursing, and in particular all things being a nursing student. Firstly, a bit about myself. So my name's Tarnie. I have been a enrolled nursing student for almost 12 months now. I started the Diploma of Nursing end of last year, so I'm about 12 months in now, and I have learned so much. Now, I frequently get asked what the difference between an enrolled nurse and a registered nurse is. So an enrolled nurse it's honestly quite similar to a registered nurse. You just don't have as much responsibilities. So basically the enrolled nurse works alongside the registered nurse. The tasks are very similar though, so you're still going to do pretty much everything a registered nurse does. You won't be able to administer some medications, and there are some tasks that are out of your scope of practice, but for the most part, the jobs are quite similar. So how do you become an enrolled nurse? So to become an enrolled nurse, you're going to need a diploma in nursing. So your diploma in nursing is usually an 18-month course. Some places will do a fast track course, other places may do a slower course, so you can do other things alongside it. Another question I get a lot with that is, what did I need to do at high school, or what other prior knowledge do I need to have? To be completely honest, you don't actually need to have done anything in high school, like your bio, physics, like all your science topics, but it definitely helps. So I actually did biology in my senior years of high school, but I did drop it because it was too much plant content. I actually was only interested in the human body side of things, and it was such a small amount of what I learnt when I was at school, so I actually ended up hating it, so dropped the subject. So I'm kind of coming into nursing with really no prior knowledge on much anatomy or biology or scientific background. So yes, it is possible to become a nurse without doing those subjects in high school, but it would definitely help with the learning process. So what type of patients do I care for, and what is my role in their care? So as you know, I am a student at the moment, so I don't currently work in the field, but I have completed 2 placements. So my first placement was in a palliative care unit along with a few other specialties mixed into that ward, and I've also worked on a stroke rehabilitation and neurology ward. Now, as far as what patients you're going to care for, it's really endless, the amount of cases that you can come across and the types of patients that you will look after. The type of patients I care for is endless. My role in looking after patients though usually will involve doing observations every couple of hours, so taking temperature, pulse, respirations, O2 saturation, and it can include neurological observations, feeding assistance, what else? Assistance with hygiene, administering medications, and just assisting any patient in their road to recovery. So there really isn't any limitations to the type of care that I am giving to my patients, as long as it's within my scope of practice. What does a typical day look like to me? Now, as a nursing student, a typical day in the hospital will look very different to a fully qualified enrolled nurse. But I think it's really useful as nursing students to know what to expect when you are going on placement. So I'm going to run through what a typical first day of a placement may look like. So the first day is normally a little bit different to the rest of your time on placement. Your shift normally will start a little bit later if you're on the morning shift. So I believe that I would start about 8 o'clock. First thing you do is you will all have received an email on where to meet Normally it is the main entrance of the hospital or some other community meeting area. From there, you'll have somebody from the hospital come down and speak to you and run through what to expect on your placement. Typically, you'll then be placed with a registered nurse from the ward that you are working in, and they will take you up to the ward and show you where everything is. This will involve seeing where the lunchroom is, seeing where the bathrooms are, seeing where the nurses' station is, and all of the essential places to remember while you're on your placement. Now, from there, you'll normally start by being allocated a registered nurse to work with for the day, and you will pretty much shadow them for the entirety of your placement. You may work with the same registered nurse, you may work with a different registered nurse each day. It depends on the hospital and the ward that you've been placed in. So normally my typical day as a nursing student would start with doing routine observations. On my previous placement, we would do 4-hourly observations. So normally twice a shift, I would conduct my routine obs. So that involves going around to each patient and ensuring that all of their observations are between the flags. If there are any discrepancies, then you would notify the registered nurse immediately. As a student, there is a lot of observing rather than actually treating the patients, because many things are out of your scope of practice and you are of course there to learn. You'll probably witness a lot of medication being administered. Where I have been, I learned a lot about tracheostomy care, suctioning, cardiac monitors, and what to look for in your patients to note if they're going downhill or not. It's important to remember that your experience will be different depending on what specialty that you're working in, but you will never be alone. You'll always be working with a registered nurse and within your scope of practice. You'll also learn to interact with a lot of different medical staff, so doctors, physios, dietitians, who else? The list is honestly endless. So you will learn a lot in a typical day on placement in the hospital. Myths and common misconceptions about enrolled nursing. Now, there are many myths and misconceptions about being an enrolled nurse. I would say the number one thing is that just a lot of people don't know what it is. I think a lot of people have heard of AINs and registered nurses, but they don't realize that there is a role in between called an enrolled nurse. Or if people have heard of enrolled nursing, I don't think they realize that the responsibilities are quite similar to that of a registered nurse. I feel like a lot of people believe that you are there just to do pad changes and shower patients. That is not true. Yes, you are going to be doing that, but it is not the only part of the job. I think too that that's a common myth about nurses in general, is that all you are there to do is to wipe people's bums and help them shower. It is not that at all. There is so much more to the job than that, but also assisting patients to feel clean and fresh is actually a really special experience, especially after some of them haven't been able to shower for days or weeks. It's a really special feeling to be able to help someone to feel their best self. And it's actually amazing to see the difference between someone before and after you've showered them, because it is crazy the confidence that it can give people when they feel fresh and clean. Okay, so the positives of my clinical area. There are so many positives to being an enrolled nurse. I think the obvious ones are, if you are a caring and giving person, it is a really rewarding job. And you get to help so many people in their most vulnerable stages of life. Even, for example, with all of the lockdowns going on in the world at the moment, I was able to be on placement in a hospital in an area of concern for COVID-19. which meant that none of my patients could have any of their friends or family visit when they were in such a low and hard time of their life. It was a strange experience. You get to really see the emotional toll that not having family and friends around takes on a patient, but it is a really special experience to be a part of, and I think that is one of the best things that I have already noticed coming out of nursing, was that I got to be there for people in their time of need and support them through a really difficult time in their life, and form really special bonds and connections to my patients because of that. I think more positives include, of course, seeing the rehabilitation process of your patient. It's absolutely incredible to see, particularly when I was working on the stroke rehab ward. It's incredible to see patients come in with slurred speech, not even being able to talk or move, and then weeks later being able to talk to you and communicate and start even walking again. It was just amazing to see that recovery process and how good medicine is in being able to help people who are suffering. What are the challenges or negative parts of being an enrolled nurse? The negative parts, I honestly feel that people just don't realize the work that we do. I think a lot of people are really grateful for nurses and the work that we, and the tasks that are a part of our everyday routine at work. But I don't think they actually realize the physical and emotional toll that it can take on you working in that environment. And this is coming from a student who has only been in the hospital for 8 weeks. So I think even when I went in and did my first placement, I didn't realize how heavy the job is until you're actually in there. You deal with so many different people and so many different diseases and conditions. And I don't think people realize the importance of our role. I think people know it's important, but I don't think they realize just how important it is. So I think that would be one of the negatives. I just don't think enough people realize how hard nurses do work for your loved ones, your friends and your family. What tips for students or a grad in your area would you give? Ooh, there are so many tips. I think number one, be organized. Get your assignments out of the way as quickly as possible, and then you can use that rest of the time to, I don't want to say relax, but I do think you should continue studying, but it takes that load off your shoulders and it puts the fun back into learning. I find if I've got assignments looming over me, I don't enjoy the learning process as much, but if I get all my assignments done, I'm actually wanting to go online and research and study, and I enjoy that process a lot more when I don't have those pressures. So definitely be organized. Always be willing to lend a hand, especially when you're on placement. So what I mean by this is say yes to everything. If someone is saying, oh, do you want to come to CT with me? Do you want to come and watch me do this? Do you want to come and do a pad change with me? Say yes all the time, because you never know what your next placement is going to hold. So I know this is kind of a silly example, but for example, my first placement involved doing a lot of bed washes because a lot of my patients were bed bound. My second placement didn't do one. So it's kind of like, take those experiences while you can. That's a very simple experience, task that you do as an enrolled nurse. And it is fairly easy to learn, but again, the more you do tasks like that, the more comfortable and more efficient you get at them. So never say no to any tasks, always say yes, particularly to things that might make you uncomfortable. You're going to see a lot when you are out working in the field. So I think you would rather see it as a student for the first time than as an enrolled nurse working in the field for the first time. Alrighty guys, that is it from me. I just wanted to say a massive thank you to the Nurse Break for giving me this opportunity to speak to you guys about enrolled nursing. There is so much to learn about being a nurse, and it's great to see pages like this providing a platform for information regarding the healthcare industry. It's really helpful from a student perspective, and I'm sure it's really helpful for people that are already qualified and in the area and in the medical field. Thank you so much. Bye.